Welcome to this week's Power Hour. We are thrilled that you can join us today as we talk about a very important topic, which is stress and burnout, and in particular how we're taking care of ourselves during COVID-19 and in particular healthcare workers and who are dealing with patients at the front lines and others as well. My name is Christina Natterdog, and I am heading up the KIPL Institute for Physician Leadership at the North Carolina Medical Society Foundation. And I'm here today together with my colleague Aubrey Cuthbertson, and Aubrey will be monitoring the chat where we would love to see your questions. You're also welcome to unmute yourselves and ask your questions, but we really do want to invite you to engage actively with our guests and our moderators today. So the moderator is, as always, Franklin Walker, VP of Rural Health Systems Innovation from the North Carolina Medical Society Foundation. And our guests today are Dr. Cormac O'Donovan, who is a neurologist and currently at the Wake Forest Health System. Dr. O'Donovan is a name within the area of stress and burnout and is a very often featured speaker on the topic in many different forums. Dr. Marion McCrary is an internist, and she's actually one of our current Leadership College scholars, so we're very thrilled to have her be part of this important topic, and both of them have a strong passion and interest in this very important topic. So just to remind you what the purpose of the Power Hours are, as you know, we are weekly and we do cover a different range of topics. The whole purpose of the Power Hour is to build conversation, collaboration, and community, which is more important than ever as we are dealing with the situation of COVID-19 and are moving forward towards the new future, but we still need to really come together as a community, and we want to offer that possibility to all of you who are joining us today. So with that, thank you so much again, and I'm going to hand it over to Franklin.
Thanks so much, Tina. Welcome again, everybody, to Power Hour. We're really excited to have our panelists today to talk about physician burnout and stress. So let's get right into it. So the first question I want to ask you all is, during COVID-19, how has it been affecting your practice, your institution, your staff's morale, and what lessons have you learned during this period? And I'll start out with Marion, please.
Hi, thank you. I'm actually in a different situation right now. I'm not practicing clinically, so I can really only answer that kind of from secondary accounts of the folks that are I've talked to in the practice where I was, and I think that there, of course, are lots of changes, and they're trying to support themselves and their staff as much as they possibly can. And I think we'll talk a little bit later about some strategies to do that with, just being with each other, developing community and things like that. But Dr. O'Donovan may be able to speak a little bit more about that since he's practicing currently.
Sure. Cormac?
Yes, thank you. For those of you who may know, I have worked at Wake Forest for the last 25 years. I'm predominantly a clinician involved in some research and education, but I do work in clinical neurology with a focus on epilepsy. So my experience, like many, might be a little different. I am not working in the emergency room or frontline, so I'm not in the front line, but I do work on the inpatient service. But predominantly, I've been the most of my time has been spent in the outpatients working on telehealth visits. I think, it's interesting, not to be vague, but it's two effects have occurred. One is it's kind of been obviously it changed the system, that this is not normal, we can say that. We have seen how people, coming together is key. We have talked about the model from the last century where the doctor kind of existed on their own, but now it's more team care. So the aspects about how your team works together is certainly being tested in an amount. I think even in about 6 weeks so far, we have seen a little bit of a shift. And why do I say that? Because initially we had an initial focus where everybody was focused avoiding the virus, and that still pertains. But maybe if we listen to the experts, we'll become a little less. So the focus has changed, and then we're thinking, how much are things going to change? So I hear people asking questions, and we've done surveys, and I can talk about that a little bit later, but we've looked at, like, what are your main concerns? And to be honest, in a group, all need to be entertained, because some people will be worried about the virus. Some people will worry about really a new structure. I mean, financial implications are absolutely extremely important here. But to individuals, and looking at them as holistic persons, they have different degrees of resilience. So just because one survives it, once they become under a different stress. So what I've noticed is that people are reacting to it differently, but they're looking for connection. And with any stressful system, because they are human and feel powerless, and not to use this anecdote, may act like children, they may act out in certain ways, and we need to be tolerant of that. Because I think anybody who is protected from stress, so that would be my answer. And I'm asking questions because I'd like to get the full picture and be reckoned that I am not that model for sure about physicians are very driven, very perfectionistic. But I think one would all agree that you have to work as a team, and it's a function of a team. If you empower the team, so I'm seeing that yes, it has affected. It's unfortunate that some people are being furloughed, reduced hours, you know, and everything can be viewed differently. There are benefits to telehealth. There are downsides to telehealth, and maybe it's not all going to be a black or white. We are looking for a cure. We would all, I think, agree we would like the virus to go back to wherever it came from. So I think it's very important to ask questions and the people how they're feeling, because that will decide, once I get a temperature, how people are feeling, because we can't control, we'll have some other crisis and it will come back again at some point, is once we act together, increase the safe space. You hear about sometimes if we work together, then it will be more. So that's, you know, I think it's early phases, but I am concerned. I'm glad we're having this conversation, because going forward, we need to be together, but respect the differences, because people have different types of perspectives on this.
That's a great answer. Thanks. Dr. McCrary, what are the leading causes of physician burnout?
Yeah, there are several. I think the stress of the work that we do, whether it be the hours, the intensity of it, as Dr. O'Donovan was talking about, kind of in the hospital in these circumstances and any time, as well as just the fatigue that can happen sometimes with the hours that we work, depending on the specialty that you're in. Medicine is something that people go into because there's a meaning, there's a purpose, there's a pull. And sometimes when you find that meaning is going down, it's not as much as it was to you, that can drive burnout. And being in circumstances where you just don't feel like you have enough support, and you have a lot of responsibility, particularly if you can't be flexible or autonomous in those are known drivers of burnout. And really just trying to put your work and your life into some kind of integration can be hard in medicine. Those can be some personal things, but there's also institutional culture. One of the things that we all struggle with is kind of losing control over the things that we do. There's very few of us now who really get to make all of the decisions in the care that we give. There's inefficiencies in practice. The EMR, which we love and hate at the same time, and just the complexity of our care that we give. There are a few other things with that that are known in terms of just being under the gun all the time to meet performance measures. For some people drives burnout, and just finding that professionalism not being what they want it to be in their colleagues at times is also known to drive burnout. So that's kind of a list that I have reviewed. I don't know if Dr. O'Donovan has other things he'd like to add to that.
No, I certainly would agree with what Marion had said. And again, at an individual level, they can be very varied because, you know, humans are different and the reasons they went in have very similar themes, with a core value of taking care of patients and doing a good job, not just for taking care of the patients, but you can have some professional fulfillment. So whilst you're doing that, it makes you feel good within yourself when you are doing things for other people. Mm-hmm. I mean, the reason we talk about burnout now, if you look at it historically in the last century, don't quote me on the date, but the physician was an unregulated thing, a person identified in the computer. This is before medical school, before medical boards, and they kept doing things, but we had to be accountable. And so then there was regulations, and there might be in other professions, but particularly there are things about over-regulating. There are benefits to regulating and keeping standards for patient expectations. But now we've gone to the other swing. People ask me, why are we talking about it now? Because we've become over-regulated. So I think we should be accountable. Every professional, every human being should be answerable to some kind of standards. But we have the dilemma here that number one, it's these people have good insights and they went into it for the right reason. Mm-hmm. You can always pick an outlier, that the people are worried that people will scam any system, and that depends whatever profession you're in. But I think now is the point, and people are concerned that when the public are there, it's not about the volume of work. And for the most part, people who go in to medicine because of the stresses of getting accepted into medical school, residency, and fellowship, and practice, and on, I think that's a given for the most part. It's not that they don't want to work hard, but they want to do proper things. They want to do an efficient job. And like any human being, they want to contribute. Every human being contributes in life. So I think those are the struggles. It gets mixed up that are the doctors complaining about working too many hours. It's more of efficient things. I mean, we got to control the cost in healthcare. Absolutely.
So, Cormac, can I jump in and ask you, and actually this is for both of you, but I was thinking you said something that kind of reminded me of something I read in Atul Gawande's book, the Checklist Manifesto, and you mentioned the answerable to standards, right? And he mentions in his book that having the knowledge and being able to provide, so the complexity of the science is also a stress factor. So I was wondering, considering the times right now with COVID-19 and the lack of information or the lack of knowledge or not knowing this being a complete novel virus and all that, how do you both think that is impacting stress and burnout more in this issue? And do you think it does, really?
I definitely think it does. I mean, for physicians and for anyone, the unknown, there's no end date. When can kids go back to school? When can, we start doing the things that we normally do? If we knew this was going to be 3 months and we could hunker down and be fine at the end of it, I think a lot of people would understand that. It's the unknown of it and when it's going to end. That's a really hard piece of it for people in terms of being anxious, being, just worried about what's going to happen in the future.
I would echo what Marion said. I think, we, from how we develop our ego or how we professionally identify ourselves is certainly being knowledgeable. And I think despite the fact that it's on the news and the lay public are picking up bits and may have heard more than me, who tries to limit the social media, you're kind of feeling powerless. One, for me personally, I don't know would be the answer. I have some ideas about what we might do. And in the short term, let's assume there's not going to be any change, because I'm concerned that we're not dealing with a situation. It's going to end, and we're waiting for that news brief to come from our governor, from our senator, whatever, the politician, the director of the medical school. But I think it's working and having the conversation, and whether people really believe it. We're in a we're in a world here where we have access to information, and, you know, believe it or not, the good news versus the fake news and what it means to different people and whether these people can be believable. And I think that's going to be a key thing we're saying going forward is, as we dismiss, if we become to be our same authentic selves, then that would be the best we can. Because I don't think we have a cure for the virus. I'm not sure what mask it is. I mean, masks are good, social distancing, whatever, but it's, now we're kind of got to keep, and it changes every day, you know. But I think we've had more change. People want to change, they want to get better, but not in this huge amount. So we've kind of asked for this, and there can be positive or negative perspectives on the whole thing.
Okay, let's switch gears just a little bit, and let's talk about finding your community or tribe. I know this is important for you guys in your space. Marion, can you take the first shot at that, please?
Yeah, this was definitely something I wanted to talk about today, and I think, you know, finding a group of people, a community, is definitely a way to help with resiliency, to combat burnout, to move people from one side of the spectrum to kind of feeling engaged and wanting to be a part of that. Community can be, you know, your partners in your practice, your health system, your hospital. That can be a society like the Medical Society, or for me, the ACPs, the National Group for Internists. But it can also be a community that you find in other ways. You know, we just talked a little bit about social media, good or bad, but even before we were kind of stay at home and not as connected physically, you know, that has started to become a big area of community for folks. And I'm part of several physician groups on social media that really have been helpful during all of this process with COVID. First, in trying to find out information when it first came out, and people from all over the world and all over the states are sharing that, and then now just being there and being supports for folks. So that's kind of the ways to look for community. We definitely know having a community helps with resiliency. It helps increase happiness. That social connection has been studied. And it really helps with finding self-compassion. When you get in the right community where you can really be yourself and be vulnerable, all of those things are very good for healing and as well. And I think that, you know, one of the examples that I'll give is I went to the lead meeting last year for the Medical Society, and I think her name's Elizabeth Kelly, who's at Wake Forest, was one of the speakers, and she founded a group of women who would just meet at night, women physicians. And I think it grew from this small group just so they could connect and have this community. And I think now she's getting meetings up to hundreds of people. I got on the email list. I just haven't had a chance to get to Winston to go to them. But it just really has opened up a nice space. So that's a long-winded answer to, you know, community and the importance of it. But I definitely would advocate for folks to find that, whether it be a few people, whether it be 10,000 people on a Facebook group. It really can help you through many things.
Thank you, Marion.
Yeah,
Cormac, can you add on to that, particularly because you're involved with Wake Forest Baptist, so I think probably your sense of community is going to be a little bit different.
Mm-hmm.
Yeah, let me talk about my, you know, personal level. I think one way to look at this is, you know, the world was very busy and we were all working very hard, and now we have this unusual situation about some of us have a lack of work, you know. So what do we go to work for? Whether you're a doctor, a nurse, whether you work in the grocery store or whatever. And I use this kind of algorithm that this isn't in any particular order. I work at Wake Forest, and I'm proud of that. And am I part of the story? Do I feel like I'm connected? Okay. And if you think about that, and then like every human being, not because I went into medicine, I'm interested in the science, but you want some stimulation from the job, you know. But the other part that people come for is the social. And if the social doesn't mean that people are not working and spending time out in the park and going back to work, but there is important, and social means different things. And the other thing, we did talk about autonomy, but people don't want complete autonomy, they want some structure. And here's what I'm thinking is people don't know what will the structure of the day be. So I'll give you an example. I'm in academics. There has to be some structure, some kind of guideline, some kind of motivating. If my boss was to come to me and say, you can see, one patient a month or something, then you might think, well, I have a nice, easy job, but there's not any structure. And structure means structuring. What we're finding about structuring your day is put time in there for you. Because the person who's working straight for an hour and thinking they're getting productive, it's better to have somebody for the 30 minutes. So I do find, well, I want to go back to the social and finding your tribe. I mean, the person who invited Facebook, human demand was connection. But we found it's probably been over and it's not as many meaningful. So I would say in the Cormac O'Donovan checklist is how many, what I would say, not big, long conversations, how many water cooler conversations. So it's not, doesn't go, hey, Joe, how's your day? How are you doing? Well. But you know that Joe wants to talk about it a bit more. But making that connection, making that ice breaking, because I have found that when I went through burnout, when I went to like-minded people and I could touch base with them, we can't, it's not under control to change the world. We're working there. We're making inroads. There are pluses and then there are minuses. But I think finding your tribe, I think now I hear people going to different WhatsApp, which are select groups. And I'll be honest, I have different groups and when I have different needs. I have very good friends. So it's a matter of the community. Very important as we deal with COVID, because it will affect everybody differently, is to be tolerant. It's called psychological safety. So please speak your mind, because otherwise we are wasting time in these meetings, and there should be, it's a code of conduct and a code of culture to say. So Franklin's saying, the tribe can be very different. I think coming down to smaller groups and breaking out, but it's literally like doing the surveys and then digging deeper and coming back and what is your need? It is not for me. I want to hear what you need so I can support you. Whether I'm a physician, whether I'm a friend, whether I'm a family member, it's going to be really important. And now will be the test of it.
So let me ask you about this
I love
question,
the comprehensive.
Go
ahead.
Sorry. But let me, because
No,
you both,
go
and I'm going to hand over to Franklin. But you were both talking about it from, more of an individual perspective. So I was curious to hear your thoughts around, what do you think, or how do you think that organizations can help build a sense of community or a tribe from within? Like what from a collective level can be done in order to foster and promote these things? And Cormac, you were talking about psychological safety, which is of course, extremely important, but how can you, as an organization at that level, help foster and promote this? And Marion, you were shaking your head, so let's hear from you.
Yeah, I think what we're doing right now is trying to, first we're starting giving a value, doing these hours, power hours, and getting the information out to people. And seeing the same groups of people on here every week, you just start to kind of feel like you're learning the same things, going through the same things together. And I think that's one of the things, and just being a resource. And then advocacy. I mean, when you're part of a group that is trying to help you find PPE when you need it, or to go to the legislature to get small business loans for the smaller practices that can't get them. I think that sense of community is we've got each other's backs is really important. And I think that's one of the things the bigger societies can do to kind of speak on behalf of a smaller group of people or one person to really make their voice heard. And that just reinforces the support and that it's a safe place, a safe space to be yourself.
So Tina, I think one way to address that is what I mentioned about the groups and creating like-minded groups. Marion's mentioned about Elizabeth Kelly's. I know Elizabeth Kelly. I know what she's doing. It's been very good for women physicians. It can always be changed. You might ask, who are the women physicians that are not there? I think it's very important. But I also think it's important that maybe within the group at work, that maybe these groups could be set up to meet and just express feelings. It's really like sharing the load, the problem have, And it's not that everybody should be on, the example I use, I work with secretaries and nurses and residents and technologists, and they make the day go. And it's not for me to say, get over it, because if they're having a bad day today, I know tomorrow will be mine. So that sense of community and the leaders, I think, are always important. And they, feel that they have to put on a show. But I mean, my message to leaders is, we just want to know that you care, because we know that you don't know about it. We have Tony Fauci. I don't think he's got the 100% answer. It's been good, and people like that. But I think it's very important that the leaders step up and say what their limits are, and say, but they're going to support us and they're going to make it happen. And giving, that they can give the gratitude from inside. It's very important, to express that gratitude. It's kind of like, bring it inside. You've seen the videos of people in the highly affected areas like Italy and Spain, but we need the small things about giving gratitude, not assume. You need to put it in words. When I give feedback to people, I got to say it's feedback, and I say, I'd like to thank you, rather than being assumed. I'd really like to thank you. So I think, that's the challenge within the institutions, and we are going to we've got to support the whole team, and I don't have the answer for that. It'll be more difficult, because you might be still worried about the virus, but there'll be some efficiencies, and some people might see their job role displaced. But I think if we're all working together, and we can reinvent. I mean, certain technologies that I got trained on are less redundant, so in a sense it will change. I don't know what the change will be, but change will come, and that will be good, because we're moving ahead as a society. But I think it's very important, within the institutions, it's challenging. We haven't really seen each other to hear about it. We're reaching out. It's slowly coming through. I think, we're 30 days, 60 days, and we have big problems. We've made big advances. I think everybody would say that. The numbers are not pretty. They're not for the person whose loved one was lost. So it'll just be different for how it affects everybody, and people will be worried. So I think we'll really be, as Marion said, in the same boat, but a very different perspective. But talking to friends and getting the groundswell information, I think this is really key. I mean, I do surveys and do measures, but I think themes are there, and it's what the people need,
Those are great answers. So I know that the AMA has a Steps Forward module on physician wellness, and I was wondering if we could talk about that just a bit. So Marion, can you explain why that is important in your branch of medicine?
Yeah, I definitely can. I have a lot of experience with that framework of strategies because I've used it with my practice in terms of doing some practice transformation. So the Steps Forward program is a group of modules that the AMA has created, and it looks at ways you can make changes in your practice, in your organization, big picture culture, in order to transform practices, but also to prevent burnout in physicians. And then there's a section which is about burnout and well-being. And as Tina mentioned earlier, I'm participating this year in the Leadership College, and the project that I'm working on is actually taking the steps in one of the modules, the well-being module, and trying to break those down and make those more personable. So I'm trying to put together a group of videos to do that. So I've really dug down into that a lot. If you see me looking around, I've got outlines for the project kind of taped to the wall, so I'm kind of referring to them at times. But it's, I think as we were talking about the societies, the big societies, all of them are trying in different ways to help physicians on the front lines. And so any community that you're involved with as a physician, should have some ability to help you with resources for wellness. And so this is just one of the ways to do that. But I do think it's important, and we've touched on a little bit earlier, is, wellness is personal, wellness is institutional. It's a big picture, and you can't really fix one and not fix the other on the way to being well. So I think people will say, we used to tell doctors just to go do more yoga and that would solve it, and we realized that's not the answer, and it actually makes people mad to say that. So it's one of the ways, and more to come from me about it, that you can pursue ways to make changes for wellness.
Super. Cormac, can you add on to that?
I think, Marion, the AMA has been very active in trying to provide modules and very practical things. I think when we talk about wellness, things we need to be cognizant of is that the physicians have been, on an individual level, to themselves, to patients, advocating for healthy activities, not just your prescription for your medication, whether you'll have a procedure done. So those parts are kind of in place. But at the same time, I think we're trying to make system changes. So here's the crux about getting balance. So what we've struggled with is, there's no question, I'll just take mindfulness as an example, yoga, I've missed out on some things, but if you don't get the time to do it, and if it's not something that you really enjoy, because again, coming back, taking the work and taking it in balance is very important. Now what we found out is that the burned out physician is not necessarily a failure, because if you don't do any work or you're not involved, that's the risk you have. So you need to be all in and be engaged. You want to be engaged in the work, and that's the downside. You might say, well, so it's a matter, I think the term I'd like to make the audience aware of and may know about is what is professional fulfillment about your job? I was in high school, I decided to become a physician. By the way, there were other things I might have considered. That doesn't mean, we have people who have talents in many different areas, as writers, as musicians, but, you got to make some choices. And that's very important too. What do you do for your balance from an activity, not necessarily from an exercise thing? So I think it's, bringing those things and adjusting them. There are modules that Marion has gone to, and you just bring them to the local source. We do this at the American Academy of Neurology, where we look at projects where people really want to get involved, I think everybody, this is such a widespread thing. Professional competence, say, what did you want to do? What was your vision as a child when you went into this, and go back to it? Like, let's take all this stuff, prior authorizations, RVUs, safety guidelines, having to double check everything, alerts, what do you want to do? So I think that's, in terms of what the AMA modules are trying to bring system change. That's what we need, people who make changes for systems, and I would advise you to maybe get a perspective from the outside, it's a learning. Curiosity is important. I've researched more, but I'm curious to learn more, because I know there are many different variations for individual people. But the AMA, yes, has done a very good job in that regard, and then there's the National Academy. The key thing is, I think everybody wants to preserve control for time. The physicians want the time, and the patients want the time. If you think those is the key element of the relationship, because you can Google and you can find other resources for information, but relationships are really important between physicians and between the physicians themselves and with the patients. Once that gets intruded on, they feel injured, they feel they're being disrespected, and honor them. Respect doesn't mean they're on a pedestal because they have certificates and qualifications and papers. So those are things that are important.
So I'm curious about one thing, and that is, we've been talking quite a little bit about some of the most common factors to stress and burnout. We were mentioning welfare here right now. There's one thing that really I'm curious to hear your thoughts around, and that is loneliness. As loneliness is one of the biggest factors as well, and I wonder if we somehow forget to talk about that aspect of how it's impacting, and I really want to hear what your thoughts are around that aspect. And
yeah.
Marion,
I could start with that. I actually was just listening this week to, there's a podcast by Brene Brown where she speaks to our former Surgeon General, Dr. Murthy, I believe, if I pronounced his name correctly. And that's been a big platform of his, is loneliness, and has actually got a book coming out. So I think about that, in medicine in a couple ways. So I was in a big group. Dr. O'Donovan is in a health system, but there are a lot of physicians who are in small practices or in rural practice who are isolated in some way, physically or geographically, I should say. And so I think that for them, it's very easy. It's easier for me to see loneliness in that person where they just don't have other physicians close by necessarily to bounce ideas off of. But you can have that same loneliness where you just don't feel like you connect with anybody in a larger group as well. And I think that goes back to finding that community, whether it be a small community or a big community, really to help you be able to express what you need and have people who know what you're talking about, have been through that, to really be a sounding board for you. But I'm very interested in reading his book and seeing what it has to say. I think it's more prevalent than we think.
And I want to just add, because I think it's a huge leadership opportunity to actually pay attention to whether there are people on the team who actually might be lonely, and we're not even considering that, because that would obviously, require a different approach to that person. Yeah. Cormac, do you have any thoughts around loneliness and how that?
Yeah, I mean, I do think it's important. I could give you several examples, but one of the examples I quote for myself is that each year I have a bunch of friends that I meet from kindergarten. And we've been getting together, and I've missed a few scientific meetings, but I haven't missed any of these meetings. And it might look like I'm all about the fun, but the connection with these people who I've known, who know me as me. They know I'm a doctor, but they really are, it's a time when I can be myself. And if I'm not being myself, they will call me out on it. So it's a bit like the tough love approach. Mm-hmm. So I think loneliness is huge, and so you have that point of reference where you're, looking for, and then there are other groups that I've connected to since I've become internist physician Burnout, which was stimulated by me, at some point taking time out. So I don't do it for any cause. I just do it because I just think about what could happen, Mm-hmm. I'm grateful that it was, it might be now considered for most people, burnout, a very bad experience, you won't continue. So I don't have any rivals. I just do it day by day. But I think loneliness, it is important, because one of the things when physicians become burned out, aside from the work, is that they're comparing to others. And if you compare yourself to others, there will always be somebody, it depends on your mindset. Unless you change your mindset, you can win the Nobel Prize. It will just become. So I think that some people, what I have noticed, and doing this informally, where people have come to talk to me, is they feel extremely lonely. On the face of it, they don't. Residents, they've been at parties, but silently. So we need to kind of dig a bit deeper and feel that they're okay. So you might say, do they have good social support? So my almost first question when somebody would come for an interview, I've seen their credentials, they've got references, is how is life for you? Because that's been seen that people with more emotional intelligence is going to be important, because it's humans looking after humans. Mm-hmm. And you're going to be exposed to this. It's how they react, how they deal with the disease. We hear about people dealing with heart failure, with bad spine and different things. So I think the loneliness part is there, and maybe, that's contributed, there's models that has contributed to a lot of the root cause, the social determinants of health, is why people use drugs as their friend. When they have more friends, they use less drugs. So we're all at risk, Mm-hmm. It's very important that we know that people are time. I would encourage people to keep in their activities and know there's something bigger than ourselves. One of the main things, and I'll finish this part, is spiritual health. If you believe that you're bigger of yourself, humility is big. Some people would consider that I do a lot of neurology, I would know, but there's still answers. We still don't have answers. I have to have that discussion every day, my patients, but we're working on it. And as long as they feel that we're working together, I think, they appreciate that. As long as they can trust you,
Yeah, yeah.
So the loneliness is a big issue. It's been shown by the World Health to be more prevalent, like 1 in 4. And true loneliness, who can you call, not to help you in a thing, but no matter what, who can you call at 4 o'clock in the morning? That number has gone down from 10 to 1. And we've got more Facebook and more Twitter. So it's a societal thing. Things affecting doctors are the same thing as affecting humans, in my opinion.
Yeah. And I love what you were saying, we're humans treating humans. I love that. It's brings in a very important aspect of the humanity piece from the physician, him or herself, right? One last thought I have for you, and then I'm going to hand it back to Franklin. But so thinking about now, there are physicians that are self-isolating in order to protect their family. Right, so they might be, sleeping in the garage or, the guest room, or they're keeping a distance from their family. How do you think? What do you think would be important to do in order then to combat the sense of loneliness that might come from that, or what are your thoughts around that?
I think I actually know someone who's doing that, and I think it's just trying to keep that connection as much as you can. I've seen pictures of people renting an RV and putting it in their, driveway, and they're staying in the RV. And so, their families are getting out, they're seeing each other. So I think if physically you're separated, that technology where you can FaceTime and see each other, I think is key. And I know that's being used in hospitals for patients as well. So I think that is one of the ways. And I think just, encouraging them, and I don't think they need encouragement, but to use the folks that they're working with in their healthcare environment, to be their surrogate families at this time, and using them to lean on them as well, I think is key. So just kind of redefining that definition of family at this time.
I think we have to, Marion said, it's a very tragic situation when somebody has worked, and it's not that we live to work but work to live. That should be the perspective. That would be distorted, and it's kind of tragic that there is no, but it makes sense, when we're wearing these masks, we're not doing it for ourselves, we're doing it for other people. So staying at home, I had a lot of guilt when I saw my friends in the emergency room and people working in very close proximity. So I think it's important, but it goes back to another practice is to express gratitude for what you have, and to make the best of a bad situation. People might think that's difficult, but the things about at the end of each day, how you start the day and how you begin the day with approach. And a lot has to do with, self-compassion, but also, speaking if you're the child and your parent is the physician, it's important. But those things should happen sort of all the time, because one thing I think what I'm hearing in my institution is, and others, it's not particular to Wake Forest, is there's an interesting dilemma. The people who are in the emergency room, and there's others involved, intensive care units. I have made many different friends across different specialties, family physicians as well. But here's the interesting thing is that we're doing this, they are doing this every day. It's of greater degree, and we need to appreciate that. So does it become relative, if the COVID virus comes down? So we need to keep it going. It could be anticlimactic, because whilst they did great service, and they're up for the challenge and really like when things get going, I'm worried about, well, it's not as bad as it was. This could come back when they have a hard job coming in. So the ER physician who lives in the same community as me, should they be cheering him every day? Because we need to give the little uplifts. It's the small worlds. This is not about money. It's about personal recognition. So I think those, the isolation, the quarantine thing, and I think quarantining and staying apart, heaven forbid, if we're on some flattening the curve, if the curve goes up again, we're going to have to be ready for it, And then it'll be even more difficult, because people will If they were slow to start and realize the impact, they'll be slower then, and we'll be left to our own devices.
You know, it occurs to me you guys are so passionate about this branch of medicine that you find yourselves in. One of you is a trained internist, one's a trained neurologist. I'd really like to know what made you have interest in this particular subspecialty, and so Marion, let's start with you.
Oh, that's a long question or a long answer. I'll try to be concise more than my email to you. But I actually told this story at the ACP. We had what's called a story slam back in February before the stay at home. And for me, it was really just having interest in learning new things. I enjoyed what I was doing and taking care of patients and my partners, but I was really wanting to learn how to take care of patients in a different way. I did feel like I was at a level of burnout and did a lot of professional and personal development type things to try to figure out what was really important to me and what was my priorities. And I definitely could share that process and those strategies with folks if you're interested. I found that one of the things I did was to take a strengths test. And the second highest strength I had was love of learning. And so I have found out since that if you use your strengths in your job, that you are happier. And so I actually did some training starting last year to be trained as a health coach. So I'm using that to help patients as well. So for me, it was kind of taking that interest in medicine, looking at it in a different way to kind of re-engage me in why I got into medicine, which was to help people, to care for people, to listen to people, to have relationships, and just trying to figure out how to do that more. And I also learned in this whole process that the more you talk about this to people, the more you realize how prevalent it is. You know, 50% of physicians, I think with the last survey for internal medicine physicians experience burnout. And a lot of people feel shame about it, or they feel like they're the only one. And so finding that community where you can talk about it, you know, spread that word to other people is really a key way of how we help people kind of come back from this and find the joy in their work, in their lives. And so that's a short, kind of broad answer to what you asked, but I think figuring out your priorities, what's important to you, and then using that in the best way you can, I think is key for anybody who's looking to make changes in their life and continue to find that fulfillment.
Cormac, how about you?
You know, just to, let me answer that question very briefly, but let me tag on to what Marion said about people suffering in silence is, here's an example. I've given some talks at national meetings about burnout, and I've given talks about epilepsy, and, you know, the epilepsy I would hope is interesting, and I'm asked to speak because I know about the state of the art, and there's lots of questions. But within an audience, no matter whether I'm talking to dermatologists, family practitioners, advanced practice providers, or nurses, it's high. It's high for all. We need to remember that. But you don't get the same amount of questions live. Now, if you do an audience response system, you say, is this the most important thing that worries you? Yeah, 75%. But afterwards, what happens is I get several emails. Could I talk to you in private? It's like, we could have discussed it. You made great points. But people don't want, they still want to be strong, seen as strong and being as human. Yet, if you ask patients what they want to see doctors who are human. So we have this conundrum, and we are competing against each other, and we will compete because the residents will want the fellowship positions and the physicians will, so there'll be an element of competition here, but people talking about suffering in silence. So for me, how did I get involved? Well, I say it's pretty simple for me to be committed to the cause. This thing. At one point we had some problem within the hospital. I got very stressed about it, and it was decided that maybe I should take some leave, or I decided to take some leave, talk to my boss about it, and, you know, I'd come to that point But as you can see, I'm still talking about it and want to acknowledge it because, as you like, I fell into I was kind of put in that category. We talk, well, are you functioning up to grade or not? People don't deal with the shades of gray. And so I realized that I met other physicians and I came back and I cannot think, there was nothing different about them. They were better human beings, as good as human beings, but they didn't. So I have every day, I worry that not those people I met there, but my colleagues, it could easily happen to them. When I went through the process, I considered myself the biggest failure and that I didn't come up. So that's number one. Number two, the characteristics are, first thing is, who are you? When I was in high school, I guess I was interested in psychology and psychiatry, and I've been kind of faking it as a neurologist pretty well for the last couple of years. But I think deep down, I've kind of had an interest because it's not only the passion, but also the curiosity. What do you want to be? Well, I'd love to be a lead guitarist, and people want to listen to me, but you don't have the curiosity or the skill. But you got to be curious. I think intellectually, that desire to know more and more, and every day, whatever I say today, I'll say something different based on everybody's story. That's where we're at. And the third thing is, as I warn the people, I got to use your strengths can be your weaknesses because you can use them. My strength is woo. So I tell the people, if you don't want to get involved in burnout, just don't come talk to me in the corridor because I need to turn it down. But the likelihood is I feel so passionate about it, I'll probably enroll you into the group. And there's so much to be done. Please, the message out there, tell your people, you can do it. Here's the return on investment. If you save one physician, you will save 3,000 patients and their families. The return on investment from a 5-minute, 10-minute conversation over coffee is ginormous, not necessarily to the health system, but to society in general, and everybody can do it. I don't have any special training. I have a passion and curiosity, but it's important to me, and I was afforded the opportunity, the wake-up call to get involved. So I think that's how we can change things.
So I think one thing that springs to my mind when I hear both of you talk is, obviously the identity, but, as we know, highly skilled professionals will not seek help or ask for advice, right? And such as physicians, for example, they're not known to, at least, to seek help and ask for advice and things like that. When they needed to, their own difficulties, they're more prone to help others, right? And Cormac, you're kind of like touching on that, but what do you think from an organizational perspective, whether academic, whether a healthcare organization, what do you think is a way to help foster and promote some sort of making it okay? And I know it's a huge question and it's a huge topic, obviously, right? Because we're touching upon culture, we're touching upon psychological safety and everything. But just from your perspectives, and Cormac, you were kind of like saying that's kind of like how easy it is, invite people into this, right? Do this. But what do you think should be done or can be done more?
I know more and more this is being discussed in training programs. Mm-hmm. So we're starting with physicians as they're being trained and kind of moving through the process. So there's not a resident, I'm sure, that hasn't heard of burnout and all the strategies. So I think that talking about it is very key. I think the things that we were talking about, finding a community, finding a person that you feel like you can have an honest conversation with where you feel supported, just trying to facilitate ways to have those conversations. I found that you just get busy. And you've got 3 hours of charts to do. Sometimes it's not easy to have a 10-minute conversation with someone that you really want to talk to. And so I think, figuring out ways to actually build in that time for community in practices rather than your monthly practice meeting can really make a difference. So it may be a little forced in some circumstances, but I think people will begin to see that it's something that they want to do and not something that they have to do because of the benefits of it. So
I think there are, the research is still out for what might be the best system. Clearly people who have more self-awareness and emotional intelligence, and that may be translated into a mindfulness practice, and making it more easy to learn, you know, because I think some people, a busy physician might think, I've got so much to take care of, I can't take a time out for myself. They have a guilt conscience about that, but they don't want them turning up short. So what we've done at Wake Forest is provide a peer support group, because it helps to connect with somebody who knows what you're going through. We have a phenomenal Department of Psychiatry, psychologists, counseling services, and they are very skilled when some things get to a level, but sometimes it's just a conversation. So we use this peer support group where we will identify somebody in a soft way with the complete mission is to help them and not to provide judgment and to provide support. You know, I'm very concerned. So I think investing in those kind of things are important, because the other thing is that along the biggest spectrum, somebody will come up with a challenge, you know, and it's not necessarily that you're broken, because bad things happen to good people, you know, and if you live in a, you know, in isolation, if you live in a bubble, then life will be meaningful, because you know, it's by the scars that you have, it's the people who have gone through the ups and downs. Because if you're, not to say, I mean, it's a bit self-serving, if your resume hasn't been crystal clear, you might not get a job, but if you've had ups and downs, maybe you'll be able to troubleshoot. Maybe when something like a COVID-19, I know people never thought that was going to happen, maybe they'll adjust better. So sometimes those people had to adjust to those failures. But I think what Tina says, you need to invest intentionally and know that you're about it and it means things. And the leader's got to communicate consistently. You know, I think people are communicating lots of Zoom, but even the smallest things, you know, one thing that's happened, you're getting Zoom fatigue, you don't have to be turned on. You know, I'm here giving a talk, you might, but it's just making even the small connections. People writing small notes, handwritten notes, you know. Many people who are younger than me don't know about the letter where we used to post it in the mail with email, but those things are important. We're going to come back to cycles. It's a bit self-serving because I'm not 20 years old and I'm not 30 years old. But I think what Tina's saying is now is the time that we know where it is, because we have no idea when we work it out and the nurse is able to come back and the secretary and the orthopedic surgeon gets more, there's going to be some kind of fallout. So I think we've got to be even more and more community, you know. I mean, we were bringing meals, it's a different phase. It's if anything, it's helped, you know, and just staying in the moment and dealing with it as it is. I'm not waiting for tomorrow, because I'm not going to do what I'm going to do today, I'm going to do tomorrow, and that's try and reduce the stress. It's not eliminating stress. We're not going for stress-free, because there is advantage of stress. I can give you the book by Kelly McConnell. It's a defense mechanism. You should respond to a stress for your own safety. But when it becomes chronic, this is the thing about burnout. People, well, I got over that, you know. I had a patient who complained. It's like, yeah, but that's how they were feeling. You have a doctor who's not. So those are like important things. I think we really need to invest within our institutions, and North Carolina Medical Society, when you contact, we've tried to have a group where we've had very common themes, you know, health systems compete against each other. But in this world, I am just convinced that the people that I have met through this journey, they've gone through burnout. They know what they're talking about and want to help each other.
Listen, we're just about at the top of the hour, and this has been such an interesting talk with our panelists. I want to thank you both for your participation today, and thanks for everybody that's been listening in. I'm going to turn it back over to Tina to close things up, and we'll see you next week. Tina?
Thank you so much, Franklin, and thank you so much to Dr. O'Donovan, to Dr. McCrary. This has been a very insightful and interesting conversation. I wish we had a few more hours to keep talking about this extremely important topic. Thank you to all of you who listened in, and we hope to see you next week as well for another topic. Do keep in touch with us, and please reach out and let us know what else we can do. We really do want to make sure that we can serve you the best we can for what we do at the Medical Society and at the Medical Society Foundation. So thank you so much again, and I hope you do get to enjoy the weekend when you get there, and please take care of yourselves, and thank you for everything that you do.
Thank you, Tina. Thank you all for joining.
I mean,
Thanks, everybody.